heard various times throughout the pandemic that coronavirus impacts everyone, regardless of their wealth, political affiliation, and age. But people in the rural and urban areas of the country have responded differently to that threat.
Indeed. Journalist Zaid Jilani charted those differences along with the individual threat that each population faces and whether it is possible for urban and rural populations to basically get on the same page about the pandemic. Zaid joins us now with his thoughts. Great to see you, sir.
Yeah, it's great to be here.
Good to see you, Zaid.
Just start by laying out some of the differences in approach between urban communities and rural communities.
Yeah, so Gallup, polling agency, actually did some polling about this, and what they did is they looked at the most dense areas of the country and the least dense areas, the fifth most dense, fifth least dense, and they found that there was like a 24-point difference in terms of the behaviors of peoples in those areas, in terms of whether they were doing things like avoiding stores and restaurants, doing the typical like social distancing measures.
And what does that tell us about that? Why is that, Zaid? I mean, is there a reason that these citizens are behaving differently? I mean, in terms of getting on the same page, is it about communication, or is it just about the way that people live lives differently? What do you think?
Well, I think it's a bit of both. I mean, for one, we have to recognize that the pandemic itself is actually worse in the most dense areas of the country. I think something like New York has more cases than some entire countries, or many entire countries. Every researcher I talked to in public health said that population density, particularly the presence of subways and metro systems, makes diseases generally spread quicker, infectious diseases. So one, there's a different reality right now, but I think that shouldn't make people in rural areas complacent, because rural areas also have some unique vulnerabilities, ranging from a lack of decent health care. I think the majority of counties in Georgia, for instance, don't have any ICU units in their hospitals, to also having tighter communities. So you might see people less in a rural community. You're not as dense of a place, but they tend to have tighter families. They tend to be regular churchgoers. I think the outbreak in Albany, Georgia, was actually from a funeral. So I think those tight social networks still present a sort of threat, which is why I think that even though rural communities do have a lot fewer cases right now, they're going to be presented with some really unique threats going into the future, just because they're a lot less prepared.
And do you see sort of cultural and partisan differences playing into this as well?
Yeah, there are some cultural and partisan differences. For one, I think throughout the polling, more conservative-leaning Americans have been a little bit less anxious about the disease, although that's changing. I think in the past 2 or 3 weeks, we've seen that level out a little bit. And actually, there was a study out of mostly the UK, but there was also some American research done showing that actually partisan differences kind of disappear once you control for fear of the disease. And I think fear has gone up so much with it being all over the news, with there being cases, many more cases throughout the United States, that actually partisan differences are starting to level out a little bit, which I think is the good news, in that we're making the virus less partisan in our perception of it.
That's interesting, Zaid. One thing I remember you were tweeting about is that there was this caricature in the New York Times about rural Americans, and saying that, they weren't staying at home as much, and just it reflected kind of a reality that people in D.C. and the New York Times especially don't really understand the lives that rural Americans live, particularly in the South. What are some of those things that we're seeing on display with this coronavirus?
Yeah, so I think, a few things. One is that having a tighter community, meaning that a lot of people in rural areas, they rely on their close family or close friends for social support. So you may have an elderly family member who you regularly bring groceries to. You may be having some services at your local church or synagogue that you kind of rely on to keep your community going. I mean, the way of life is very different in a lot of those places. I think there's far less access to broadband internet, so you really can't do a lot of the same working from home. You can't get things delivered as easily. There are just a lot of differences geographically that create cultural and economic differences that I think just make life very, very different in those places. I don't think many people know this, but the county with the worst life expectancy in America is McDowell County in West Virginia. I think the male life expectancy is like in the early 60s. So these places are already just so much worse off in many ways. They tend to also have higher rates of obesity, and they tend to have older populations as well, which means that once there's enough kind of spread there, these could be some of the worst hit places in America.
Right.
And higher rates of uninsured as well, which is only going to get worse as people lose their jobs and are kicked off of their employer-sponsored health care. Zaid, I also wanted to ask you a little bit about the politics of this. I mean, the media, and in certain cases justifiably so, have been very critical of the Trump response. We've certainly been critical here, especially of the early days when he wasn't taking it seriously. And still, there aren't enough ventilators, still there aren't enough tests. There's still a lot of problems there. But you compare that relentless drumbeat of negative criticism from the media to, relatively sort of fawning over Joe Biden. And yet, if you ask the public who they trust more to handle this crisis, it's pretty split between Trump and Biden. What do you make of those dynamics?
Well, look, I think if everyone looked back at this, they would say they would have preferred to see a much earlier and tougher response from Trump and probably from other figures as well. But I think Trump is somewhat benefiting from it just being a reality that a number of different governments kind of have the exact same trajectory in terms of how they responded to this. There's a really good New Yorker reported piece about South Korea, how South Korea responded so slowly at first that people wanted to impeach the leader, Moon. And I think that so many different places across the world had the exact same trajectory, whereas first they downplayed it, they thought it wouldn't be that bad. And then they started taking much more proactive and extreme measures. And I think the United States had the exact same trajectory. And because people kind of moved with the same way that Trump moved, most people. Look, Joe Biden wasn't talking about this in January and February very seriously. The only thing I remember him really saying was he was condemning Trump for banning travel from China, which now most people would agree was probably a helpful move, even if it wasn't sufficient. So I think that because Trump is probably seen as behind, but because he kind of moved along with everyone else who was behind, including state governors, local officials, members of Congress, presidential candidates, and other countries' governments, it probably hasn't hit him as badly. And the other reality is Joe Biden has just been absent for so much of this. He's not been in front of the American people the same way Trump is holding a press conference every day announcing new measures, bringing on respected health officials like Fauci and Birx. So I think all those things kind of have kind of worked in his favor with regards to this. I do think as deaths count up and as people get more wary of being kind of indoors, maybe Trump's approval rating will slide a little bit, and I think it already has a little bit. But I do think all those things are benefiting him.
Right. That's one thing I wanted to get with you, which is that there's this, right now his approval rating is actually quite high on the way that it's being handled. What are the conditions that it could slip? Do you think it would be economics, or if cases were to spike, or maybe a combination of both? I mean, it's just such like a game theory of political analysis trying to figure out how this is going to play out.
Yeah, I think the larger effect that most Americans personally will feel will be the economic effect. I think in studies where they, like Iceland, I think had some of the broadest testing, they found like 50% of their population who had this virus were asymptomatic. It may be, I think that the health pain of this will be very concentrated, probably more towards people who have health problems, more towards older populations, uninsured people. But the majority of the population will probably never feel a health effect of this, but almost everybody will feel an economic effect. And I think if we're talking about, I think something like 30% of people probably have already lost some jobs or hours out of this. If that number continues to grow, I think that'll be really where Trump is ultimately judged in the referendum in November, and whether he can actually corral a real response in Congress, like what Pramila Jayapal or Josh Hawley are talking about in terms of keeping people employed, not allowing these mass layoffs to happen, and just having a Band-Aid on it with some, stimulus checks or unemployment. I think whether he can do that will ultimately be how he's judged on this, because I think everyone at the end of the day concedes that he doesn't have a magic bullet against a virus. Nobody in the world does. Every country is suffering from that. But he does have a number of tools at his disposal, working with Congress, to rescue the economy and keep Americans employed and keep them safe economically. And if they don't do that, I think he will be judged very harshly.
Well, and the theory that Sagar and I have been working with here is that essentially the election's kind of out of Joe Biden's hands. He sort of has to sit back and essentially watch and hope that Trump makes mistakes, both because of just the inherent landscape of this being a crisis type situation, and also because of his own inability to sort of forcefully insert himself into this conversation in a way that is truly compelling. I just wonder if that's kind of the way you're thinking about it too, or if you have a different analysis of the political landscape.
Well, I think that there was polling this morning showing, or released this week, showing that Trump still kind of maintains his electoral college edge. I think in overall popular vote polling, I think Biden's a little bit ahead, but it's looking a lot like election 2016. And I think a lot of how someone like a Joe Biden would break out of that is by actually showing presence and leadership. And I don't I don't think he really has necessarily during this crisis. I think throughout the entire campaign, he's portrayed himself as kind of the safe default choice. But it's different when you're not the incumbent. I think Trump being the incumbent has given him a little bit of an edge that he didn't have in 2016. He doesn't have to convince people that he can be president. He already is president. And I think particularly in an unsafe time, incumbents get a little bit of a boost out of that. And that's really Joe Biden's challenge to show that, he can actually be kind of a challenger, because he's also kind of campaigned as an incumbent in certain ways, talking about going back to being VP. But it's different when running against an incumbent.
Yeah, certainly very different. Zed, thanks for breaking it down for us. Really appreciate it, man.
Thank you.
Next on Rising, former Amazon employee Chris Smalls. He lost his job after he led a walkout at a Staten Island warehouse. He shares his story coming up on Rising.